20 minutes of nonstop news continues with royal revelations. It is the talker of the day. Shocking allegations in an explosive interview with Prince Harry and his wife Meghan. In an interview with Oprah, the couple describes painful palace discussions about the color of their son's skin and intense pressure that led the Duchess of Sussex to contemplate suicide.
I was really ashamed to say it at the time, and ashamed to have to admit it to Harry especially.
The couple says mounting pressure, both public and private, along with being cut off financially and lack of support and empathy, drove them to leave the royal family. NBC10 Cydney Long spoke with mental health care experts in our area today. The question, will Meghan's words help others who are struggling to cope?
In this tell-all explosive interview with Oprah Winfrey, Meghan Markle says she was 6 months pregnant when she contemplated suicide.
I just didn't want to be alive anymore. And that was a very clear and real and frightening, constant thought.
Markle at first confiding in her husband, Harry, that she didn't trust herself being left alone. She would later be told by the royal institution or firm at Buckingham Palace it wouldn't look good for the royal family for Meghan to seek help.
Suicide can be an impulsive decision, or it can be something that's well thought out.
Dr. Joel Fine is an emergency room physician and violence prevention researcher at the Children's Hospital of Philadelphia.
I think it's very impactful for anyone, with or without fame, to tell their story and to explain how they raised their hand and said, I need help.
The Duchess's pain, she says, also centered on discussions about Archie's skin color by an unnamed royal.
In those months when I was pregnant, all around this same time, so we have in tandem the conversation of he won't be given security, he's not going to be given a title, and also concerns and conversations about how dark his skin might be when he's born.
What?
The immediate thing that went off for me, the light bulb, if you will, is when she did have baby Archie and all of this drama is still continuing on with the family and she's feeling pretty marginalized and segregated, was postpartum depression, something that so many women face.
Philly-based licensed professional counselor Shamir Holmes says mental health has not been normalized as it should, especially within the African-American community.
Although this is on the rise, there tend to be less clinicians and psychologists, psychiatrists of color. And so that can be off-putting because people feel as though perhaps a white or a non-African-American professional won't quite understand where they're coming from, some of their cultural norms, their cultural values.
Reporting from Philadelphia, Cydney Long, NBC10 News.